My name is John Malmstrom, and today we'll be discussing the importance of physical therapy as it relates to athletics. Imagine you're on your final floor pass. You take a deep breath as you're about to finish your floor routine. As you take off from your roundoff, you feel your ankle pop. You have excruciating pain going up your leg and into your calf. As you land on your back and wait for medical assistance, you hear the medical professionals talking about how you have just ruptured your Achilles, an injury that takes 4 to 6 months to recover from with the proper help. Physical therapy is something you will most likely experience if you've been involved in any kind of sport. A study by Johns Hopkins Medicine recorded how many injuries occur in athletics per year, and this is what the study showed. In the US, about 30 million teens participate in some form of organized sports, and more than 3.5 injuries occur each year, which cause some loss of time of participation, which is experienced by these participants. As a gymnast, I've experienced plenty of injuries, which means I understand the value of physical therapy in order to get me back in the game. Physical therapists make a difference by improving the quality of life through rehabilitative care, as well as exercise. The 3 main points I want to focus on today is what physical therapists are, the various areas in which they can work, and what the requirements are to become a physical therapist. And lastly, why I believe physical therapists are important, whether you are an athlete or not. While the career in physical therapy isn't an easy job, and for this reason, I'm going to talk to you about what that career looks like. The job of a physical therapist is a career in the medical field, specializing in rehabilitating injuries as well as educating patients on how to keep up with their health. Physical therapists can provide care for athletes, the elderly, or someone who has developed a sickness that affects their mobility and function. But a physical therapist doesn't have a limitation in who they provide care for. They can work in a variety of settings, including hospitals, clinics, schools, sports and fitness facilities, work settings, and nursing homes. State licensure is required in order for a physical therapist to practice in healthcare services. I'll get more into state licensure later. A career in physical therapy can be incredibly challenging. In order to be a great physical therapist, you have to be patient with who you're providing care for. Some injuries aren't going to be easy, and you have to understand the patient is trying their best with what they can do. You have to pay attention to the little detail and not be negligent with the patient's capabilities, and also be aware of any changes that may occur during that rehabilitative phase. Lastly, you have to be incredibly knowledgeable. Even if you chose to specialize in a particular area of physical therapy, you should stay up to date with the new advancements and best practices in the field. Because of this, while working in a medical field, this means like a long list of requirements. So what does that look like? Well, physical therapists, there are many qualifications to be a physical therapist, including schooling, certification, and training. Physical therapists must earn a bachelor's degree in a health science, exercise, and/or sports science. But depending on the state, you may need to fulfill prerequisites in physics, kinesiology, chemistry, biology, physiology, and anatomy. In total, you're looking at about 6 years of schooling in order to get the education for a PT. And after you finish with your schooling, you're required to be accepted by a Commission on Accreditation of Physical Therapy program, which helps with your state licensure exam, and you have to pass that in order to be a physical therapist. This is also referred to as your DPT programs, which means Doctor of Physical Therapy program. It's a curriculum which is about 3 years long, and it consists a lot of like those prerequisites I talked about before. Approximately 80% of DPT curriculum is a classroom and lab study, and the remaining 20% is dedicated to clinical education. PT students spend on average 27.5 weeks in their final clinical experience. To maintain licensure, physical therapists must meet continuing education requirements every 2 years in most states. Continuing education courses keep physical therapists current with the profession's standards and needs. With such a long process to become a PT, why do we need it? Why is it important? Again, the career of physical therapy is important to all of us. Physical therapists work to diagnose, restore, and maintain physical function. They can prevent injuries as well as create treatment plans to improve strength. Physical therapists can reduce pain by utilizing exercise, soft tissue, and joint mobilization to improve the quality of life by eliminating or teaching patients remedies to avoid the pain. By providing this type of care, help improve mobility in athletes so that they may return back to their sports with the least amount of limitations. While you may not be involved in any sport, PTs could be the reason you return to normal work or help you return back to your normal day-to-day activities. Ultimately, if physical therapy wasn't a successful career, our athletes would be incredibly limited as to what they can do as far as movement and function are concerned. Throughout this speech, I discussed the job of a physical therapist, which is a career in the medical field, specializing to rehabilitate injuries as well as educating patients on how to keep up with their health. What the qualifications are to be a physical therapist, including the schooling, training, and certification, and why I believe the career of physical therapy is important to all of us. Because physical therapy allows for others to stay active and continue to participate in what they enjoy doing. They make all the difference by improving the quality of life through exercise and care. I believe physical therapists work to provide normality when injuries or health problems occur, and they can help athletes stay motivated to achieve their goals in their sports. Carol Welch, who's an expert in biosomatics, said, "Movement is medicine for creating change in a person's physical, emotional, and mental states." Thank you.